Hopkins brings his own, since he has a lot of pages, I put a marker there for you. So
Oh,
you can
perfect.
Because I don't like bring his own.
Good. And so where will I be sitting? Okay.
Good. How are you?
Good. So I took these out for you.
I saw. Thank you. Good morning. I can't tell you how excited I am to welcome the class of 2024 and all of their family and friends for this long-awaited and so richly deserved white coat ceremony. My name is Maureen Richards. I'm the Assistant Dean of Medical Education and Evaluation on the Rockford campus, and it is my pleasure today to introduce Dr. Alex Stagnaro-Green, the Regional Dean of the University of Illinois College of Medicine, Rockford. Dr. Stagnaro-Green is a renowned clinician scientist and an academic leader with extensive experience in curriculum design, development, administration, clinical research, and public service in the fields of thyroid and pregnancy. He has published more than 100 articles, over 50 abstracts, and has given more than 60 national and international presentations. A graduate of Mount Sinai School of Medicine, he completed a fellowship there in endocrinology and metabolism, following a residency in internal medicine at the New Jersey Medical School. In 2005, he received a Master's of Health Professions Education, and in 2017, a Master of Healthcare Administration, both from the University of Illinois, Chicago. Please join me in welcoming Dr. Stagnaro-Green.
We are so happy to have you here today. It broke our hearts when we were not able to have our white coat ceremony at the beginning of the year for the first year medical students. But core to the concept of what we're all about is that becoming a physician is not a solitary event. It's a family event. It's a community event. It's with your friends, your colleagues, your kids, your wives, your spouse, your significant others. So we are just so delighted that you could all be here today. It's a shame we have to wear masks, but COVID is still around to a small extent, and so we will do that just to be safe. So these were my unscripted remarks before starting, but shows you part of the excitement that we have to be here today and meeting not just the students who we've now gotten to know over 2 years, but everybody else who's here. So good morning. It's my pleasure to welcome the parents, the grandparents, the relatives, the children, the spouses, significant others, and friends of the class of 2024 to the white coat ceremony. As I mentioned, it was critical that we have everybody here today because what the white coat ceremony marks is a demarcation from an individual who is a non-medical profession into the medical profession. 30 years ago or 40 years ago, when this was first formed, it was done at the transition between the second and third year because there wasn't much clinical activity in the first 2 years. But that's changed, and so typically we have it to welcome the students and family early in the first semester. This obviously was different, but I think it's going to work out just as well. For many of you, this might be your first time on campus, so I thought I'd share with you a little bit about the history of the College of Medicine. This is our first anniversary. How about 50th? Our 50th anniversary. We began in 1972, and we started as a medical school because the legislature and the individuals in Rockford, as well as in Peoria and Urbana, realized that the citizens of the state were not being served the medical care they needed with just a state medical school in Chicago. So we are part of one of the 3 quote-unquote downstate schools that were created in 1972 so that we can extend our medical care to all communities that live within our great state. Since then, we've graduated over 2,000 medical students. Many, but not all, are residing in Illinois. You know we have a strong rural program, and we have many students in the rural areas. And on top of that, we have a large population of our physicians who are here in Rockford. The campus was formerly the site of the tuberculosis sanitarium, and it grew into what's called a health sciences campus. That means it's not just a medical school, but we also have a nursing school here, we have a pharmacy school, and we have a doctorate program in nursing. We have plans to expand greatly over the next 5 to 10 years. Our goal, and we have a mock-up of a building already, and we are on our way to raising $100 million, is to bring a college of nursing. Bring a college of dentistry, social work, public health, allied health sciences, all to this campus. That would give us a total of 800 health science students and be the largest health science program that's devoted both to working with the community and working in rural areas. In addition to our mission of excellence in education, we also have a strong mission when it comes to research. If many of you, and I won't have you do a show of hands, have gotten the Shingrix vaccine. The Shingrix vaccine is given to people over the age of 50. There's almost no one who can't get the Shingrix vaccine, and it protects individuals from developing shingles as an adult. And many of us without that vaccine would develop shingles. Those of us as clinicians who've treated individuals with shingles, or those of you out there who may know of, or maybe yourself have even had a case of shingles, know how painful, how debilitating, and how that pain can last for many years in something called post-herpetic neuralgia. Our vaccine is now being used not only in the United States, but throughout the world to decrease the suffering, the morbidity, and the mortality that's caused by that virus. And it was developed right here in Rockford by one of our former faculty members. Something we should be very proud of. But that's not all. We have other vaccines in the pipeline. In the next 2 to 3 years, you will hear about a heartworm vaccine for dogs. And those of you who have dogs know what a concern that is, and you have to get pills, and every year your animal will be checked for that. We're developing a vaccine that could wipe that out. And then there's a disease called lymphatic filariasis, or elephantiasis. That's a disease that affects many parts of the world, not within the United States, but it's debilitating, it's socially isolating, and we have developed the first vaccine, and it is right now going through the different phases of trial, working with various companies and soon with the FDA to do the various phase trials so that we could bring it to market and decrease the suffering that occurs. So on top of that, research in the field of nanotechnology, stem cell regeneration, tribocorrosion, cancer of the prostate and the lung, community active research is all going on within our facility. And these are all areas that our students have the ability to get involved in. And finally, the College of Medicine has a strong commitment to our community. My very strongly held belief, and one of the reasons why I came here 9 years ago, is we're a state university. We're here to serve and protect and help improve the health of the citizens of Rockford, Winnebago County, and our state. And so we have tremendous interactions with our county. We have served as a hotspot in a positive sense, where individuals can come 5 days a week and be tested for COVID-19. We run a saliva-based test, which is easier and actually more sensitive and specific than the nasopharyngeal test. And everyone gets their results within 24 hours, and most get it within 12 hours. My granddaughter, who's 5 years old, needed it to go back to school on Monday, and so she was here. After about a half an hour, we got her to get the saliva in the cup, and at 10 o'clock last night, she got the results. My 2-year-old grandson looked at it, and he looked at it, he goes, "Grandpa Alex, no." We're going to have to take him for a nasopharyngeal. to talk about the white coat ceremony, tradition that welcomes medical students into the profession of medicine. It was first started by a man named Dr. Arnold Gold, a pediatric neurologist from New York City, in particular Columbia. I had the pleasure of getting to know Dr. Gold and his wife, Sandra. These were two individuals whose heart and soul was focused on how do we make the care of our patients more humane? How do we improve the training and support of our students? How do we practice medicine in our society in a way that we're most proud of? Today, I think of it as a transformative day. It's a little bit odd because we're transforming you 2 years after you started, but there was a pause, a COVID-19 pause. But let's look at it as a transformative day nevertheless, because the white coat really does symbolize a lot. From this day on, you will be viewed differently by society, including your parents, your friends, your family, and most interesting, by yourself. You will start to have a different self-image. You will be seen as a member of a noble, altruistic, and healing profession. When you walk into a hospital room or a patient's room, you will introduce yourself as a medical student. But you have the white coat on, the patient will not differentiate you from a resident, a fellow, a junior attending, a senior attending. You're part of a healthcare team, and they will look to you for advice, for comfort, for knowledge, and for guidance. With this comes tremendous responsibility and the beginnings of your journey into a wonderful profession of medicine. Over the years, you're going to grow into the white coat. You'll develop the requisite knowledge, skills, analytic thinking needed to be an outstanding professional. Simultaneously, and as importantly, you will evolve your professional identity that is integral into becoming a physician. And that's slightly different for each person, and you will need to feel your way. And in fact, you will feel your way throughout your whole career, because there are things that happen when I interact with patients that make me take a step back and rethink certain things about how I interact with patients and where my professionalism is at. This journey does not occur quickly or alone. In fact, as I just mentioned, it's a lifelong journey. It requires incredible discipline and sacrifice. However, the rewards are immense. I can think of no better feeling than when I have served my patient. And it could be that I help them prevent a disease, I help them treat a disease that they're dealing with so they could have a better quality of life, or I can help them have a meaningful death when we've utilized all of the tools that we have in the medical field. And now it's time for that person to pass on. But we could do it in a way where we don't abandon our patients. We work with our patients. We work with their family and make sure that time and that transition time is as special and painless and blessed as it can be. The people who are here today, your family and loved ones, will be critical partners in your journey. To you, family and friends, no one becomes a physician without the love, support, understanding, and friendship of others. It's truly the beginning of a journey for you as well. So I'll conclude by welcoming you, the class of 2024, warmly to Rockford, to the medical profession, and to share with you how delighted we are that you are going to do your first 4 years of what's going to be an incredible medical career here with us. So thank you. So one of the great things about being a professor and a faculty member is you have students who then start where you guys are and they move on and they become residents and fellows and then they become attendings and then they do fantastic things. And every once in a while we have the opportunity to bring them back so they could spend a little time on the campus and share with young students who are just starting out a little bit of their journey. Dr. Kelsey Hopkins is a 2007 graduate of the College of Medicine, Rockford. As a student, he was in the Rural Medical Education Program. He received the Excellence in Family Medicine Award, the James E. Riebel Award, a member of the Gold Humanism Honor Society, and Alpha Omega Alpha. I didn't know you could get all those. That's pretty impressive. After graduation, Dr. Hopkins completed a residency in family medicine in Union Hospital in Terre Haute, Indiana, and currently practices, I think in a very unique way, in Greenville Family Medicine. There he teaches the next generation of rural physicians as a clinical assistant professor and provides outstanding care for his patients. So it's my pleasure to welcome Dr. Kelsey Hopkins.
Thank you for the warm introduction. Good morning, everybody, and thank you for the opportunity to speak today. Let me start out by saying congratulations to you all, for this white coat ceremony marks the day of transformation in your medical education that you will remember forever. It signifies your advancement into clinical medicine and marks the beginning of a new professional role in society. This is a rite of passage in medical school where the white coat itself, along with years of training, bonds us together as colleagues with mutual respect and trust. The white coat reminds us of our dedicated teamwork to care for patients, provide public service, educate others, and support each other in times of personal need and crisis. Did you know that in the mid-19th century, physicians wore black attire to convey the seriousness as they were often summoned in the final hours and critical moments of someone's life? By the late 19th century, physicians adopted a white coat as a new standardized symbol to represent the medical profession and its authority and value to society through science. In the early 1900s, all the way to the late 1970s, medical trainees were required to wear all white, which is one of the several ways that physicians became recognized as a uniform profession. Today, the white coat remains the single most recognized symbol of doctoring in the United States. Over time, scientific discoveries and the advancement of medical knowledge have led society to associate the white coat with cleanliness, honesty, trust, credibility, expertise, and professionalism. Initially, medical professionalism was meant to align with desirable clinical values, humanism, and ethical principles. Subsequently, the definition has transformed to include clinical competence as assessed by demonstration of expected behaviors and skills that reflect those virtues. More recently, professionalism has been associated with the development of one's professional identity, where respected core values and practices align with one's identity within the profession. Ultimately, after years of experience and with major influential factors of role models, mentors, and other things, medical students develop a professional identity as a physician. In this role, physicians often demonstrate professionalism not only because they have earned their medical degree, but because of who they have become over the rigorous amount of training and education and years. The long journey into medicine requires great sacrifice in many ways. At times, it's physically, emotionally, and mentally taxing. It's not just the hours and years that are required to attain the massive amounts of knowledge and training, but it's also the dedication to lifelong learning with a commitment to meet societal demands and expectations. It's often a difficult work-life balance. But I can tell you that it is worth it. There is no replacement for what we do as physicians. It's amazing to think that with knowledge alone, you have the ability to save human life. As a physician, there is so much more that you can do besides getting the diagnosis correct or outlining a research-based treatment plan. It's the humanistic side. It's the finesse of delivering the care that cannot be replicated by a machine or an algorithm. It's understanding the complexities of multiple chronic conditions, the underlying pathophysiology for disease, the causative agent for the infection, or the medication interactions with polypharmacy. It's understanding the social determinants of health, the cultural aspects, and the patient preferences when considering why you'd recommend one treatment over anything else when all are acceptable options. The bottom line is, every single decision you make as a medical student and a physician should not be reflexive, but rather a comprehensive judgment based on your ability to recall, integrate, and understand massive amounts of information, complicated information, while weighing all of the evidence. It takes years of experience and time for this to become second nature, starting with a strong fundamental knowledge. As you know, medicine and learning medicine cannot be done solely with books, online videos, or standardized patients. The years of learning clinical medicine may be some of your fondest memories from medical school and will be a point of frequent reflection for the rest of your life. Still today, when I teach certain procedural skills, I think about how I was taught, and I ask myself and find myself thinking about the same questions that were asked of me years ago, wanting to ask them of the student. I remember the specific moments when I learned a critical surgical technique and can actually replay the memory in my mind and hear the attending physician's voice, where I was at, know what the patient looked like, and what rotation I was even on. Because the experience was like nothing I'd ever done before, and it was amazing. The next several years will undoubtedly change you as you continue to advance in your medical education and further develop your professional identity as a physician. You will experience many jaw-dropping moments of awe and have a new appreciation for the impact a physician can have by actually watching it happen in real time or actually living it yourself. As a medical student, you have the opportunity to directly impact patients' lives on a regular basis as part of the care team because of your efforts. I remember my first month of medicine rotation, which would have been my first month into third year, where I had the good fortune to find and intervene on a post-surgical patient late one night about 10 p.m. who was lethargic and nearly unresponsive from IV narcotics. In the outpatient clinic the same month, I found an asymptomatic aneurysm by abdominal palpation on one patient and later uncovered an active suicide plan that would have occurred later the same afternoon in a patient who came for a morning appointment for an entirely unrelated complaint. Something about her body language led me to believe there was something wrong, something wasn't quite right, and I often wonder to myself what would have happened had I not seen the big picture in that situation. Ultimately, we called the resident on call, we admitted her, and she received inpatient treatment, and then months later came back to thank me for having a role in saving her life. Don't ever underestimate your role as a medical student. One of the best phrases that I hope that you will soon hear is, "Thank you for saving my life," or better yet, "Thank you for saving my child's life." There are few people in this world that can appreciate what you go through besides those that have been there themselves. That being said, a small group of fellow medical students and physicians in that population are also the privileged few who can share in these amazing experiences in their training and in practice. Some of your closest friends in medical school will likely remain your most respected and trusted colleagues in their specialty of field after graduation. Outside of medical curriculum education, a key component over the next 2 years that may not be recognized as often involves your experiences with classmates, residents, and attendings. These opportunities for mentorship in medicine are tremendously important. While you may appreciate some rotations more than others, it's highly likely that you will identify several key physician role models during your training, some of which may have a large contributing factor on your choice of specialty. These physicians often lead by example, demonstrating professionalism, competence, and excellence in medicine. Competence is somewhat of a moral matter. Standardization provides the roads for expectations, but ultimately, your dedication and commitment to learning with a mastery of the information benefits others. It allows you to make a rare diagnosis you have only read about and understand the subtle yet critical differences between medications and treatment options that could be a matter of life or death. It allows you to pin down the area of the brain or the spinal cord that was affected by a stroke solely on your neuroanatomy and your clinical exam finding skills. And it also gives you an opportunity to confidently identify a specific rotator cuff muscle torn without the use of MRI, and also determine which heart valve is the likely cause for the heart murmur without the use of an echocardiogram. It's desirable to practice at the top of your training always, but knowing your limitations is equally important. Wearing a white coat may be uniform in role, but that does not guarantee clinical excellence. This individual matter of responsibility is tied to professionalism. In medicine, exemplary professional conduct is at the center of professionalism. Behaviors that reflect the underlying reasons for practicing medicine, such as compassion, respect, morality, and integrity, are essential. Effective communication and listening skills provide a foundation which medical knowledge, clinical skills are utilized to provide therapeutic intervention to the patient. Medical professionalism necessitates a commitment to truth, scientific rationalization, and recognition that your words carry influence, always. It's important to remember that professional responsibility for lifelong learning and continued advancement within our field signifies our trustworthiness and accountability as physicians. Patients expect a commitment to quality and altruism. We should demonstrate our social responsibility within the profession and strive for clinical competence and excellence. I hope that you begin to feel what I feel when I think about clinical medicine. At this point in my career, I've experienced more than 75,000 patient encounters and witnessed everything from immense, unbelievable human suffering to extreme joy, happiness, and satisfaction. I'm passionate about using my knowledge and clinical skills for the betterment of other people. I have a private practice in a small town and believe that as one individual, I'm not only competent to provide comprehensive care to a patient as a family physician, but I'm also capable of improving the health of the entire community on multiple levels. When I started medical school, I thought it would be really unique to make house calls to patients. While this is not common practice today, I still use my black leather doctor's bag that I got in my M2 year, and I visit patients in their homes when they really need it. I sometimes do minor surgical procedures and joint injections at the bedside, but most often I trust my stethoscope and my otoscope. Despite all the diagnostic advances that are in medicine today, most diagnoses can still be made clinically through a thorough history and physical exam. Sometimes there's no textbook answer for a specific situation, and you have to rely on your knowledge, experience, and training to put it all together without basic lab or even x-ray. 3 weeks ago, I made a house call into a late evening for an elderly lady who was too weak to get out of bed, too short of breath to move, and too nauseated to hardly eat or drink. She had just taken a rapid turn for the worse after I had diagnosed her with stage 4 pancreatic cancer just 2 months ago. Her family was there, and I could tell that they both sent a sense of relief when I had arrived to the house. We talked for about an hour, and I was able to examine her gently, trying not to disturb her one position of comfort. From this, I was able to determine a new heart sound, suggesting new onset congestive heart failure from the pancreatic mass that was invading her liver and causing ascites and abdominal swelling from the venous obstruction. She had new bilateral pleural effusions, which is fluid in the lungs, and her lung findings were also consistent with pneumonia. She felt chilled and her extremities were cold. Her blood pressure was borderline low and her heart rate was tachycardic. She reported dizziness and terrible nausea and right shoulder pain, as well as heart palpitations when she laid down. In my own mind at that time, I was rationalizing and trying to explain all of her symptoms from a pathophysiology standpoint, determining how to best approach any treatment I could provide while realizing that despite how sick she was, too aggressive of an approach may unnecessarily hasten her death. As I held her hand for a while, I got a sense of the anxiety she was feeling, not having answers to why she felt this way, not knowing what was going to happen next. She may have intended initially to try chemotherapy the next week in efforts of extending her time with her family for another 4 to 6 months, but now she was too weak to do much of anything. As a matter of fact, even her voice was weak. After explaining the reasons for her symptoms and helping her to understand her options, she admittedly felt some relief at that time. Together, we made the decision to try a combination of medicines, including an antibiotic for her pneumonia, 2 moderately aggressive diuretics to help remove the fluid temporarily, and something for anxiety and nausea as well. She stood there, she understood that there was no reversing her condition, but wanted more time with her family and requested the intervention. Over the course of the next several days, I adjusted her medications, and for the time being, she is now up getting around, walking around the house, and getting more time with her family. I encourage you to develop a bedside manner that is a blend of your personality traits with some of the best attributes from those you admire most in medicine. In times of panic and crisis, fear becomes overwhelming and predominant for patients. Even when all hope seems lost, your ability to put a patient at ease and provide support and comfort in the most critical of times is often unmeasurably therapeutic. Welcome to clinical medicine. It's rewarding and you're going to love it. The ultimate question for you to consider is not what specialty do you want to practice, but rather what kind of physician do you want to become. Best of luck to you all. Thank you.
Well, thank you, Kelsey, and this is one of the great parts about medical school is we have individuals like Kelsey who we could look to as a role model and strive to follow as he continues on his career. And faces the various challenges that he didn't talk about today, but that really does exist in the private practice. Anyway, we are greatly appreciative that you're here and that your wife is here as well. At this point, I'd like to introduce the faculty who are going to assist me in coding the students. Dr. Kelsey Hopkins, who obviously we've just met. Dr. Michael Potts, Associate Professor, Department of Pediatrics and Phase 2 and 3 Director. Dr. Fumi Taylor, Clinical Assistant Professor and Chair, Department of Obstetrics and Gynecology. I would like to just step back for a second and recognize the sponsors of our white coat ceremony. They have a long-standing tradition of support for Rockford medical students. They provided the monogrammed white coats that we'll be presenting to each student, and it's the support of the Winnebago County Medical Society and the Rockford Medical Alumni Fund. So thank you both. And Dr. Richards, if you can now come to the podium. I should comment that when you come up for your white coat, we will have our masks off and you could have your mask off, and then we'll all put it back on afterwards.
Hello again. Family and friends, I have to tell you I'm so excited because I've had the honor of getting to know, to educate, and be educated by this incredible group of students over the last 2 years. So I'm very confident in saying that they are very prepared to walk across this stage, don this coat, and join their colleagues in caring for our community. So with that, will the first 3 rows of students please line up? Thomas Akurago, hometown of Takoradi, Ghana, Bachelor's in Radiologic Technology and Business, Master's in Business Administration, Doctorate in Physical Therapy from the University of Mary. Ryan Alderman, Greenville, Illinois, Bachelor's in Exercise Science, Master's in Health Promotion and Leadership, Eastern Illinois University. Hunter Aldred, Williamsfield, Illinois, Bachelor's in Human Physiology and University of Iowa. Samantha Anderson, Minden, Iowa, Bachelor's in Biology, Butler University. Maggie Baker, Brighton, Iowa, Bachelor's in Health and Human Physiology, University of Iowa. Amy Barsgari, Fulton, Illinois, Bachelor's in Biology and Neurobiology, University of Wisconsin-Madison. Emily Bazzi, Glenview, Illinois, Bachelor's in Biology, University of Illinois at Chicago. Daniel Bickline, Waterloo, Illinois, Bachelor's in Biology, University of Missouri-Columbia. I think they might have grown in the 2 years. Addie Billington, Olney, Illinois, Bachelor's Biology, University of Mississippi. Christina Bloomfield, Frankfort, Illinois, Bachelor's in Microbiology, University of Iowa, Master's in Biomedical Science, Des Moines University, College of Osteopathic Medicine. Abby Brown, Effingham, Illinois, Bachelor's in Biology, Southern Illinois University, Edwardsville. Cassandra Candell, Oak Brook, Illinois, Bachelor's in Chemical Biology and Psychology, Case Western Reserve University. Rachel Carlson, Freeport, Illinois, Bachelor's in Molecular and Cellular Biology, University of Illinois at Urbana-Champaign. Thank you, Dean Stagnaro Green. Will Dr. Hopkins please join me at center stage? Justin Castanguay, Fresno, California, Bachelor's in Economics, University of Southern California. Alexandria Choi, Oswego, Illinois, Bachelor's in Biology, University of Michigan, Ann Arbor. Luke Collin, Homewood, Illinois, Bachelor's in Biology from The Ohio State University. Nathan Corman, Roseville, Illinois, Bachelor's in Biochemistry, Augustana College. Alejandra Diaz, Chicago, Illinois, Bachelor's Neuroscience, Northwestern University, Evanston. Christian Downs, Rushville, Illinois, Bachelor's in Biochemistry, Southern Illinois University, Edwardsville. Kelly Fan, Naperville, Illinois, Bachelor's in Sociology and Biology, University of Illinois at Chicago. Adrian Fouts, Girard, Illinois, Bachelor's in Neuroscience, Augustana College. Shahina Gantawala, Chicago, Illinois, Bachelor's in Exercise Science, Loyola University. Jesse Garza, Lamont, Illinois, Bachelor's Biology, Loyola University. Dante Gonzalez, Lombard, Illinois, Bachelor's in Biomedical Science, Marquette University. James Gustafson, Freeport, Illinois, Bachelor's in Chemistry, University of St. Thomas. Dane Hester, Ridgeway, Illinois, Bachelor's in Physiology, Southern Illinois University, Carbondale. Thank you, Dr. Hopkins. Will Dr. Potts please join at center stage? Madison Henley, Crystal Lake, Illinois, Bachelor's in Biology, Loyola University. Colton Johnson, Walnut, Illinois, Bachelor's Exercise Science, Illinois State University. Ellie Kent, Winslow, Illinois, Bachelor's Economics, University of Illinois at Chicago. Eric Kerber, Inverness, Illinois, Bachelor's Health Science, Benedictine University. David Katzenberg II, Monroe City, Missouri, Bachelor's Biological Chemistry, Culver Stockton College. Rachel Kim, Northbrook, Illinois, Bachelor's in Economics, College of William and Mary. Kiefer Caius, Dwight, Illinois, Bachelor's in Spanish and Biology, Augustana College, Master's in Biomedical Science, Des Moines University of College of Osteopathic Medicine. Dylan Klingler, Almy, Illinois, Bachelor's in Biology, University of Southern Indiana. Katie Lamb, Chicago, Illinois, Bachelor's in Psychology, University of Illinois at Chicago. Michael Lay, Ramsey, Illinois, Bachelor's in Physiology, Southern Illinois University, Carbondale. Hamza Malik, Algonquin, Illinois, Bachelor's in Health Science, Benedictine University. Sydney Mathis, Lake Zurich, Illinois, Bachelor's in Microbiology and Immunology, University of Miami. Gabrielle Mitchell, Plainfield, Illinois, Bachelor's in Molecular and Cellular Biology, University of Illinois at Urbana-Champaign. Thank you, Dr. Potts. Will Dr. Taylor please come forward? Shannon Pierce, Harwood Heights, Illinois, Bachelor's in Molecular Biology, University of Illinois at Urbana-Champaign. Taylor Rager, Highland Park, Illinois, Bachelor's in Health Science, DePaul University. Akshay Raju, South Barrington, Illinois, Bachelor's in Psychology, University of Illinois at Chicago. Amanda Reinhart, Blaine, Minnesota, Bachelor's in Biology, Gustafson Adolphus College. Ellen Reeder, Sterling, Illinois, Bachelor's in Biochemistry, Cell and Molecular Biology and Writing, Drake University. Claire Rosler, Western Springs, Illinois, Bachelor's in Chemistry and Music Performance, Emory University. Zachary Sanders, Charleston, Illinois, Bachelor's in Molecular and Cellular Biology, University of Illinois at Urbana-Champaign. Alexandra Seipel, Lena, Illinois, Bachelor's in Biology, Eastern Illinois University. Erin Sondgaroth, Bloomington, El Paso, Illinois, Bachelor's in Biochemistry and Integrated Health Studies, University of Illinois at Chicago. Seth Tauches, Merrill, Wisconsin, Bachelor's in Chemical Engineering, University of Notre Dame. Alexander Thomas, Lake in the Hills, Illinois, Bachelor's in Biology, Northern Illinois University. Luis Torres Gonzalez, Oak Creek, Wisconsin, Bachelor's in Physical Education, University of Wisconsin, Whitewater. Nathan Travers, Plainfield, Illinois, Bachelor's in Biochemistry, University of California, Los Angeles. Sydney White, Chicago, Illinois, Bachelor's in Human Development and Psychological Services, Northwestern University, Evanston. And last but not least, Chaz Young, Geneseo, Illinois, Bachelor's in Biology, Carthage College. I'm gonna wait till he's back to say this next one. Please join me in congratulating the class of 2024. I will now invite Dr. Stagnaro Green back to the podium to lead the students in the statement of principles.
Thank you, Dr. Richards. Will the class of 2024 please stand and recite with me the medical student oath? As I begin clinical practice, I commit, we're all going to do it together. As I begin clinical medicine, I commit myself to the of the medical profession while recognizing its challenges and privileges. I pledge that my patient will always be my foremost consideration as I strive to promote health and quality of life through education, prevention, and care. Debt of gratitude to patients from whom I will learn. I will endeavor to be worthy of their trust through competence, compassion, and honesty. I will respect, seek to understand, and value each patient's individuality. I will communicate openly and effectively to empower my patients to make informed choices that honor their values and beliefs. I will advocate for equitable, sustainable, and quality healthcare. Biases and withhold myself accountable to society for the trust placed in me. I dedicate myself to a lifetime of learning, practicing, and advancing the art and science of medicine. I will preserve the sanctity of the patient-physician relationship and approach my profession with integrity and humility. I will support my peers and respect the contributions of all members of the interprofessional healthcare team. I pledge to care for myself so that I may best care for others. I will recognize my limitations, act within my capabilities, and pursue excellence. I am humbled by the opportunity to become a physician, appreciative of those who support me, and look forward to mentoring future generations. And upon my honor. Thank you. You may be seated. So I now turn to the family and friends and ask you to rise. For those who can. And we have an oath for the students. And then I have a comment to the students after that. So please recite with me. We solemnly swear to be a source of encouragement for the class of 2024 of the University of Illinois College of Medicine, recognizing that this will be a critical period in their professional formation. We will give them the respect and consideration that they will need as students of medicine. We will help them to carry out their studies with conscience and dignity. We acknowledge the sacrifices that are required and pledge our support. As parents, enthusiastically and without reservation. I'll ask everyone to please be seated. I would like to thank the family and friends who joined us today. It is with great pleasure that we celebrate this important rite of passage for the class of 2024. I have one last message, and I'm going off script here, to the class of 2024, which is you will not be able to become physicians alone. You will need the patience, the love, the support, the understanding of your friends, family, colleagues who are here today. I think that puts a special responsibility on us, and one that I didn't learn until maybe later in my career when I thought about it more, and that it's not just a one-way street. As we ask our family and friends to understand what we're going through, to support us and help us achieve that, we need to show appreciation for all of those who are going to make their own sacrifices so that we can pursue that career in medicine. Something I want you to keep in mind. With that, we are now at official end of the white coat ceremony of the class of 2024. For the family and friends, I encourage you to go out into the lobby, take a look at some of the posters. There are little treats for everybody. And for the class of 2024, I'll ask you to be seated just for 2 minutes, and then we're going to take a class picture. Thank you, and have a great rest of the day.